Right. That is how. Correct. So disease, we are not treating the disease. We are treating the person. That is how it goes. Okay. Yes, Shashikant, come.
Yes, ma'am. No, sir, not yet. So there is a good initial discussion of how Ayurveda and modern medicine are integrating, and or at one particular platform we are integrating. I want to clarify a few things which are very straightforward questions. One, your question was how to find out that is there any heavy metals or anything in that particular medicine. So for that there are three answers. I don't want to take the name of that particular institution. So there are three institutions. One is a particular lab, one is some name followed by drug house, Bangalore, Malleshwaram. You give the sample medicine, whatever you are taking from whichever doctor, note down the doctor's name, prescription and medicines, give it to them. Around 4,800 rupees, they'll tell you all the details. What is the arsenic content, lead content, all the medicinal content, you give it to them, they'll give you. So this is available for us for you to know that any doctor from any source, you get the medicine, you go and give it to them, they'll give you unbiased opinion. It is a government funded institution. You can note down also, I don't mind, I'm not sure if it is there or not. Bangalore Drug House is what I usually, we go under, it's like undercurrent, under carpet, we don't reveal to anybody, but we get to know that which particular company have how much percentage of metals on all, we know it at the back, but we don't want to create a hustle, or we don't want to create problem for that particular institution and for us legally, so we'll keep quiet. And we use in our prescribed medication, we make sure that in this particular place where I call, if you remember, if you imagine like one circle is a conventional medicine, another circle is complementary medicine. So when these intersect, that part of we call it as integrative medicine. We try to keep it as evidence based as possible, and as much take out the bias around that particular things. And there is false allegations also from both the sides, which we need to segregate without debating or without falsely accusing each other. But we have to accept the fact that in India there is no proper promotion of Ayurveda and Yoga, which should be more. In Western aspect, if you check National Council of Complementary and Alternative Medicine, NCCAM, they give maximum funding for Yoga and Ayurveda worldwide, not India. Ayush and ICMR is second highest. So not India, we try to see anything indigenous, we try to double check. Anything Western, if a McDonald's comes to India, McDonald's old burger will cost you around 39% of unwanted fat. We never check that. And when same things comes to India, it will become 59%, if at all we see. But we order and we get it. Where there we will not check about what is the percentage of bad fat we are having. We never check. So that's our minds.
You should teach everyone that Tai Chi.
Yes, sir.
Chinese thing, no?
So yeah.
So we'll all become Kung Fu Pandas.
Yes, sir. Yes, sir. So what I mean to say is, we need to encourage that. I want to take one example what sir mentioned, Kung Fu Panda. So when I've seen Chinese counterpart, government institutions give permission for allopathy hospitals when there is a proper TCM unit in that particular hospital, then approval of that mainstream medical hospital, they'll approve it. So what they mean is, government initiative to promote Ayurveda in India, it is lacking compared to other Western things. That's why when you compare WHO, acupuncture, all other systems will come first, because they are all more, they are pushed towards more research activities, and by byproduct of that, more of allopathy doctors accept it. So we go in that category only. We exclusively use Ayurveda, Yoga, acupuncture, evidence-based as possible. So let's talk more practice. We'll do a Jacobson's progressive muscular relaxation technique, which you already know it, and multiple times you have done it. So now post-COVID era, we'll redo it again.
Is anybody practicing that regularly?
No, sir.
No.
That was a strong point where I started coming a little less to that, because we used to give only 3 remedies. One breathing technique, because we want, your lung volume to increase, so that we don't know why the disease comes. And if your lung volume is better, there might be some somewhat like neuroprotective activities should be more, neurotoxic activity should be less. If your oxygen saturation is better, it can fight little better. So to cope up with that, we have some, increased stress reduces your immunity, as a lot of research activity says. Especially I mentioned one particular doctor which all the doctors has to note down, and I want you to read. Dr. Robert Sapolsky is first doctor, you can note down his research work on the stress and individual systems, stress and digestive system, stress and heart, and stress and immunity and all. Dr. Robert Sapolsky is called as father of modern stress. Second one is Dr. Robert Sapolsky. Yeah. Second one is Dr. Herbert. Robert, I am not sure. It's American. I think it's from Stanford. His wife is a neurophysician. They both work with baboons, and a lot of research they have published. Second one is Dr. Herbert Benson, who was the first person to do a integrative medical research and given the word called as the relaxation response, which we never study in our medical system. The relaxation response, Dr. Herbert Benson. Third, another person is Dr. Mehmet Oz, who is a cardiothoracic surgeon who practices yoga and Ayurveda, pre and post cardiothoracic surgery. Fourth one is who is the present Adi Raja Maharaja. His name is changed, Adi Raja Maharaja. His name I am not able to remember.
I think you have to give us a note.
Yeah, I'll be sending all note on MS group, so not much people respond. Dr. Tony Nadir. These four people's work you see, there will be mind-blowing work, and not being Indian. So JPMR is Jacobson was a Canadian physician who was very much interested in Yoga Nidra. He adopted Yoga Nidra and modified in the form of a biorhythm, taking out all the other Omkara. He's taken out all the godly issues, all those which we Indians don't like. Has taken out and made it as a progressive relaxation technique. It is also called as NMR, neuromuscular relaxation technique. Let us practice that. It's very simple technique. 5 seconds contraction of certain group of muscles followed by 5 seconds relaxation of same group of muscles, and be aware of that. Yeah, and I think before that, I think sir can speak some few words. Sir.
So good evening, welcome to our center.
For this, mic yeah? Okay, all right. I'm fine here, Ashok. Kansta idea? Okay, so what happens, we should understand the natural history of MS, okay? So if you look at large data, left untreated, half the patients will have disabilities, mainly with walking and cognition in under 15 years of MS from the time of onset. And untreated, almost 90% of patients will have disabilities in 30 or 20-25 years. Okay, so there are some risk factors for developing disabilities that we need to understand. So previously it was all like, you make a diagnosis, wait for 6 months, sometimes wait for a year. And there were people who used to say that, when we were students, they used to teach us that, okay, you just made a diagnosis of MS, why don't you wait for 2 years? Aamele treatment ಮಾಡಬಹುದು ಅಂತ. But what happens is the MS is different in each patient. It's not, and within a given patient also, it's not same. There will be ups and downs, fluctuations. How the immune system reacts at different points of your time is very different. So it's important to recognize the risk factors of developing disabilities and address that early so that disabilities don't happen. Now, the disability is mainly because of shrinkage of the nervous system. Normally, after a certain age, I'll put it as 54. I am just 52 now. So beyond 54 years of age, the brain starts shrinking by about 0.5%, 0.4% to be precise, every year. And this shrinkage is little bit more in people with MS, and that leads to more disabilities. And if there are lesions in the lower part of the brain or spinal cord, we have several instances where brain is absolutely normal. But when you go down brainstem, medulla, spinal cord, if these regions are involved, there are disabilities. So if we recognize these risk factors and treat it early, we can prevent many of the problems with MS. Now, unfortunately, the medicines that we have as of now, they don't get into the brain. So the disease is primarily in the system, in the bone marrow. That's where the immune system is. So disease primarily happens there. and then the cells get into the nervous system, or the blood-brain barrier anta ondide. So where it crosses, the cells cross the blood-brain barrier and get into the brain. Ali hogi rest madbittu allinda it creates injuries, like having a Trojan horse, something like that. So our medicines, they all work, inside the periphery. They don't get into the brain. So whatever has gone in, nothing can be done for that. If you give rituximab, a small percentage goes there, very, very small percentage. So now of late we have given intrathecal rituximab. I think Raju Nair was our first patient, and his speech has improved. Yes, he has improved a lot. We gave a second dose, we finished yesterday. So this is one way of bypassing the system and reach the brain directly. That brings down the cost also. Just 25-30 milligram is what we need to inject. So this is one that we are trying. But if you look at big data, they say it doesn't make a big difference. But at least in his case, where we can't give, he gets a lot of infections. We can't give systemic rituximab. So presently we don't have too many options. The newer drugs which are going to come, like tall protein inhibitors, called BTK inhibitors. These kind of medicines get into the nervous system. Hopefully in a year, it's under clinical trials. Hopefully in 1 or 2 years, it should make a big difference in treating MS. Now the thing is, what happens to patients where the brain is already shrunk? So is there anything in your system which can make the brain grow? Yeah, which can make the brain grow, right? So not that brain always shrinks. If you look at the accountant's brain, accountants are people who write a lot of things. They're always in focus with money. So they keep on calculating. Their brain is not only sharp, and the RAM is faster. So they are sharp, and their brain doesn't atrophy that fast because they're always calculating and counting. So if we do some new learning, that's what keeps the brain active. And plus, if we use some supplements which can boost brain functions, that can make a big difference in preventing brain shrinkage. If we prevent brain shrinkage, then probably yes, we can prevent progression of the disease. All right. So probably our effort, Shashi, should be to do some research on alternative. In my field, like, we don't have too many options to prevent brain shrinkage. Of course, neuropsychology can help. The neuropsychology who gives the training, who makes people learn, think, that can help to a great extent. But if we have something which can get into the brain. Recently, we happened to go to a place near Kanyakumari. There's a very big Ayurvedic doctor, but he is well read in allopathy, and half of his practice is in neurology, and he gets patients from different countries. He has been very kind to come, and he'll come sometime to help us. So what he said is, Ayurveda has different types. You got something called gridam. Gridam means which is ghee form, and that is the one which hits nervous system because it's fat soluble. A brain is fat. So if you have a brain disease, you should eat medicines in the gridam form. So they already have the concept of getting something inside the brain, and if it is in the blood, you use something which is aristam, or which is alcohol based, good for us. And water form, what is it called? Kashayams. So these are 3 forms of Ayurvedic therapy, but unfortunately we don't have too much of proof in the alternative systems. What we have from the allopathy side is all evidence based. These medicines, you have data. You say that, okay, you give this medicine, so for example, you take interferons or dimethyl fumarate, the success will be around 30 to 50%. You treat 100 people, 30 to 50 will achieve no evidence of disease activity. You use a drug like alemtuzumab, your success rate is close to 90%. Rituximab or ocrelizumab, Tysabri, all these things will fall around that 75 to 85% categories. So none of these medicines are 100%. So still, there is some progression happening, and some degeneration still takes place. But there is a good category of, this is what has misled many people. So there are some patients with MS who have a very benign disease. It roughly happens in about 20 to 25% of patients, what we call as a benign MS. Even if you don't take treatment, nothing happens. And this floats,
They will tell the others that
I'm okay. Yeah, correct. Correct.
And all those things, and everybody will say, yeah, I'm taking medicine, I'm getting side effects and all those things. So
yeah. So
and we know of a lot of our people who are
and then we have a lot of people who have come back from the learned US. They say, and many of them are on with problems. They say that we read about the medicine, there are side effects, so they've not taken medicines. But we should know that there are effects. Even when you walk on the road, there can be side effects. We need to be a little bit cautious about what we are thinking and doing. So as of now, we'll focus on improving the brain volume. Maybe this year should be our theme. improve brain volume. Yeah.
ಎಲ್ಲರಿಗೂ ಬ್ರೈನ್ ಪ್ರಿಂಟೆಡ್ ಆಗ್ತದೆ.
ನಮ್ಮದು ಸ್ವಂತ ಚಿಕ್ಕದು ಇದೆ, ಸೆರಿಬೆಲ್ಲಮ್ ಮಾತ್ರ ಕೆಲಸ ಮಾಡ್ತಾ ಇದೆ.
ಬ್ರೈನ್ ಇರೋಕ್ಕೆ ಹಾಗಾದ್ರೆ ಚಾನ್ಸ್ ಇಲ್ಲ.
I just want to add this particular volume. That precisely how the examples you are giving about the people and all those things. Exactly what happens is that this matter is the consciousness. The more you are conscious about your thoughts in the mind, that itself is a very good program. You can keep the brain health more precisely. That's what yoga believes. That's what I am very keen on projecting yoga here in this particular. It is not just yoga. Yoga doesn't mean just doing some asanas and the breathing techniques and all those things. It is much more deeper. So if you really make a harmony between mind and body in the form of bridge of the breathing, that makes a very good program. Unless you taste it, then you don't understand the power of yoga. So only the more than theory, it is the practice. That is how it comes.
ಸೀರಿಯಲ್ ಎಲ್ಲ ನೋಡಿದ್ರೆ
ಅದು ಟಿ ವಿ ಸಿಲ್ ನೋಡಿದ್ರೆ ಬ್ರೈನ್ ಸ್ಪೈನಲ್ ಕಾರ್ಡ್ ಲೆವೆಲಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ತದೆ.